so we're going to be doing the health assessment of the cardiovascular. So we're first going to enter the room, close the door for privacy. You will introduce yourself. Hi, my name is Stephanie. And then you will ask for 2 identifiers and wash your hands, name and date of birth. So after that, you will clean equipment, sanitize, and yeah, then you're gonna tell the patient why are you here. So we're gonna do health assessment of the heart, check, palpate the pulses, and make sure everything's okay and there's no abnormalities. So then you're gonna ask for 2 questions: any chest pain or any smoking history. They will answer, and then you will palpate the carotid artery here bilaterally, and then you will listen to it with your stethoscope and note if there's any bruit. Alright, and then you did that with the bell, and then we're going to palpate for the apical impulse. So that is do your notch, mid clavicular, and down to your 5th intercostal. And palpate it with 1 finger. And then you're gonna palpate with the base of your fingers, the apex, sternal border, base of the heart on the pericardium. Next, we're gonna listen to the apical pulse. So for 1 minute. Sorry. I'm gonna take down again. Turn it. Mid-clavicular line. It's here for 1 minute. And we're gonna note the rate and rhythm. Alright, so what we felt, it was strong, it noted that. Next, we're gonna do the 4 valves. We're gonna do the aortic, the aortic, pulmonic, tricuspid on the 4th, intercostal, and the mitral in the 5th one. We're gonna note for S1 and S2. So the aortic is louder in the S2, and so is the pulmonic. So it's in the 2nd intercostal. And the pulmonic on the S2 is louder. The tricuspid is in the 4th one. S1 is louder. And mitral, the intercostal, it is S1 is louder. And it's in the 5th intercostal. So then we're going to repeat it, but we're going to use the bell and listen to S3 and S4. So aortic, pulmonic, tricuspid, and mitral. After that, we're gonna have the patient lean forward, and we're gonna listen to the aortic regurgitation. Regurgitation. Sorry, I have trouble saying that word for murmur. So we're gonna have the patient lean forward, so it kind of has your chest forward, and we'll listen to it. And we'll listen to apical. And after that, we're gonna look at the upper part. No skin color, texture. Make sure it's okay. Temperature, right? Temperature. And then we are gonna inspect the legs. Same temperature, color, lesions. The back of the hand. We're gonna feel, and then feel. Bilaterally, so we're gonna do it on the other side. Next, we are going to, we would make the patient lay down onto the left side. Here's my patient, left side, and we would listen to the mid-clavicular line down to the okay. We listen for murmurs. I'll keep them here. Next, we will check the radial pulse. So radial, 2 fingers, thumb side, and we will do it for 30 seconds and then times 2. Okay, so mine was 43, so we multiplied it to 86. So then we are gonna look at the brachial as well. So it's right here. And again for 30 seconds. You know what? We actually are gonna rate it. Is it a weak, normal, or strong? That it is normal +2. And this one was normal +2. We were gonna check skin turgor, so pinch the clavicle and went down. Perfect. We're gonna look for edema as well on the tibia, which tibia is the inside of your leg. Then the ankle, so we would press down on it and you would grade it. There is the +1 because it didn't sink in, didn't stay like that. Then ankle, and then foot. And then we would look at his toenails. In between his toenails, there's a gap. Make sure everything's clean and everything. And we'll rate the pulse of the tibia as well. I mean, femoral. So femoral is the leg. But that's actually pulsating. Femoral. popliteal behind the knee, posterior tibialis, and dorsal pedis, the bottom. And I think it was capillary refill too on the toes, on the nails. Make sure they are 180. And then discuss all the findings with the patient, even though we were both the patient, that everything was normal, I checked out. And yep. If you have any questions,